So Erin, I was wondering if you could share with us a little bit about what it's been like for you to have this opportunity to work with ITIE and work with people outside of medicine per se, and but in the healthcare arena, and how that's been in terms of collaboration and some of the benefits that you've kind of gleaned from this.
It's been a really wonderful opportunity because, healthcare for so long has been very hierarchical, and the hierarchy, I think, maybe worked at some point. But today we have a lot of data that team-based care is much more effective care and much safer care. So what's really fun is trying to get the concept of what we're calling fluid leadership across, which is where on a healthcare team taking care of a patient, a physician might be a leader for one aspect of the patient's care, but the dietitian might be a leader, or the nurse practitioner might be a leader. Leadership is fluid. It'll move throughout the team as needed so that everybody's ideas and care of the patient becomes very holistic. So it actually is wonderful for me as a physician because I no longer have to feel responsible for every detail of the patient. It's so much more fun to work with a team of wonderfully trained, highly qualified people where all of us are working together collaboratively to take care of patients.
Yes, and with the notion from IOM clear back from 2001, talking about the idea of just culture, I think this type of working relationship lends better to fostering that kind of environment where people feel free to talk about what went well as what didn't go so well.
Exactly, and I think, like you just said, with the just culture, we really are looking at the culture of each profession and realizing that we have a combined culture, and that combined culture is really around patient care. And so once we find the commonalities, then it's so easy to move forward, helping everybody recognize their role and play their part in taking care of the patient. But what's really fun about that is seeing everybody as equal. When our medical students come into the first year of medical school, we have them do personality type testing, and we find out who are the extroverts and who are the introverts. We talk a lot about when you're on a team, extroverts need to make space for introverts, and introverts need to bring their opinions forward. Well, it's the same with an entire team of people. Is everybody needs to be valued and their voice needs to be heard, and whoever has leadership of the team at that moment needs to make sure that everybody's voice can come out, because that's going to lead to the safest, best patient care. So that change is incredibly fun. We're seeing it happen in our family medicine clinic and our school-based health center and in our access to care clinic, and hopefully this is moving across the nation.
And how do you think this helps us transcend the picture that some lay folks have of what healthcare delivery is about in today's age?
Yeah, it's definitely been a challenge for patients, especially when we've tried to do care coordination with maybe an RN care coordinator who's calling the patient from home, and the patient says, I've never met you, I don't understand who you are. So one of the things that we've had to do is spend a lot of time educating the patients when they're in the office of, hey, we're actually transitioning our care to a more team-based model. And by the way, here's this wonderful nurse practitioner that I'm working with who may call you, or this wonderful RN, or this wonderful dietitian. These are all the people that are now part of your team in your medical home to take care of you. So all of us are here to help you, and we're just trying to broaden the patient's understanding of the healthcare team. So it's going slowly, we're making progress, but it definitely takes time, and it's very, very personal. Because we're seeing that some insurance companies are trying to do care coordination, and so patients have been getting calls from insurance companies, and of course they're incredibly leery of their insurance company calling them. So we've actually had to say, those calls you're getting from our office to just check on you and see how you're doing are from our office, not from your insurance company. It's your healthcare team. So please answer those calls, return our calls. We're just trying to take care of you, and as your physician, you can always call me. But you don't just have a physician. You have a dietitian, you have a nurse practitioner, you have a care coordinator. You have all of us who are on the same team to take care of you.
And it's a much more holistic approach, as well as gratifying, I would think, for all people involved, the healthcare providers as well as the recipients of that healthcare.
I really think so, and we've heard some great stories all around, and I think the hardest part for physicians initially was just our high sense of responsibility, of feeling responsible for everything that goes on with a patient, slowly recognizing that the whole healthcare team can take responsibility for the patient. It's actually quite relieving to have these wonderful, amazing colleagues and us as a team together to take care of patients.
To say nothing of the enhanced communication opportunities there are to really build around that patient the team that's going to provide the care for that patient.
Absolutely. Enhanced communication. Also, what's really fun is the learning aspect.
Mm-hmm.
I mean, I have so much to learn from a dietitian. You know, nutrition in medical school, there's nutrition in medical school, but it's not nearly what the dietitian has learned.
Sure, it's the same in nursing school too.
The same in nursing school. So the opportunity to be able to learn from the nurses and dietitians and social workers in the clinic is really phenomenal. It's making me a much better doctor, honestly.
Well, I really thank you for sharing that information and your perspective, because it's helpful to get an idea of how we can move forward and use leadership skills as well as collaboration in order to affect better outcomes for patients and better satisfaction for those who provide that care. Thank you, Aaron.
You're welcome, Lynn.